John Fredericks Radio Network, trucking the truth across America. Joining us now, Dr. Chad Savage had a big op-ed the other day on CSNBC. He says, Vice President Biden, don't take away our health care choice. Of course, what Biden wants to do is eliminate choice in your health care. And he is with us now, Dr. Chad Savage. Hey, Doc, great to have you with us, man.
Good morning, John. Thanks for having me on.
I wanted to have you on today because I read your op-ed the other day. You honestly believe that if Biden-Harris wins, that regardless of what they're saying now, they're going to take away all choice in health care and force everybody into a Medicare for all type program. But they're saying they're not going to do that. Biden is saying he just wants to make ACA better, the Affordable Care Act. Then he says that Trump wants to get rid of it, and Amy Coney Barrett wants to get rid of it. So then you're going to go back to getting denied for pre-existing conditions. Can you elaborate on this debate, Dr. Savage?
Yeah, sure, absolutely. I mean, so it's not my speculation. That their way to know this is to combine your own words with your own recollection. It starts way back with Harry Reid, back after Obamacare was passed, when he described it as just simply a stepping stone to a single-party payer system. And one of the worst aspects of that law, the ACA, was the individual mandate. And the reason why is it was the government forcing people through fine, which was later defined as a tax to try to make it constitutional, that if you can't buy their insurance company policies that are dictated exactly what they are by the government, you suffer a penalty. And so this was a terrible law. A part of the law, it actually restricted the number of options people had. The Trump administration came in and they did not fully repeal it because they can't, because it's a law. But they did make the penalty zero, effectively neutering it. But Vice President Biden has said that he will bring it back, and he is on record saying this multiple times, that he will bring it back if he is elected. And why that's so important is when they got rid of the individual mandate or neutered it, they allowed for other coverage options to emerge that didn't qualify under ACA. And these are things like short-term limited duration plans, which are 80% cheaper than traditional market products, and things like indemnity plans, expansion of the health-sharing ministries, which my own family is covered on, and, it goes on. And, this is very much countered by the president's plan, which is trying to combine transparency with agency. And what I mean by that is he believes that the way to correct what's wrong in healthcare is to allow people to actually know what the prices are before you purchase the products. I mean, you never go into a store and buy a Sony television with no idea what it costs. And the argument against transparency is the best way to get a deal on that Sony TV is to have no idea what you're going to pay for it. So, that's a preposterous notion. So by making transparency, allowing people to know the prices, and then agency is the power to act upon them, that through market competition, as in every other industry we see in America, that will improve quality and lower prices.
I want to read an excerpt of your op-ed, which people don't realize. May I? You said,
yeah, absolutely.
You said that ACA's intent to ensure health care, when talking about it, you said it basically made compliance too expensive for many smaller insurance companies that were in the healthcare business, squeezing them, you said, out of the market altogether, which is basically, it's not capitalism because it was government mandate squeezed them out. Then you said, and I you know what, this is not said enough. Like, people don't understand what happened here. Then you said their departure, small insurance companies who couldn't compete, you said created a lucrative regional big insurance cartels for the big behemoth insurers left standing. And by the way, in the ACA, there was a bailout for them should things go south, right? Remember that. Because that's why they signed on to it. They said, okay, we'll sign on to this because we'll get bigger, we'll eliminate our competition, and if things go south, we'll get a bailout. Well, of course they're going to sign on to it. Hey, get rid of your competition, make more money, and if things don't go as planned, we'll give you taxpayer money. Unbelievable. Anyway, you said, without the stabilizing effect of competition, these insurers, then the big ones, the cartels, double their premiums between 13 and 17. Thus, Americans were forced not only to buy to buy health insurance, but choose from an ever-shrinking number of ever more expensive plans, all the while becoming increasingly underinsured, forced to buy the minimum coverage, which didn't cover anything with $10,000 and $15,000 deductibles. This one paragraph has summed up what Obamacare did that Trump and Pence and the Republicans have been unable to articulate. And I want to commend you for that, because I've lifted it out. I mean, this is the one paragraph that sums the whole thing up. ACA benefited big insurance companies, squeezed out the competition, raised premiums, gave people insurance that they had to buy, double the premiums. They got underinsured. They did pre-existing conditions. So it basically just transferred over insurance coverage to other people, and it was a total disaster. And then as soon as Trump said no more mandates, the whole thing started to collapse.
Yeah,
right?
and so much of it is a misnomer, unfortunately. They talk about the marketplace, for the ACA exchange, but there's really in many places no such thing as a market, as people many times only have one or maybe if they're lucky two options to so-called choose from. So there's really not any competitive pressure there to control prices. And by analogy, Walmart has good prices. Well, if they were the only show in town with no competition, do you really think that would persist? And the answer is, of course, no. Competition is a way of keeping people honest. And I'll tell you, as a doctor who has a free market practice, and this is supported by the America First plan by the president and the Healthcare for You, which is through the Job Creators Network, which is I'm a member of. We have what's called the direct primary care practice. We work directly for our patients. And if I don't do a good job for them, they can easily go down the street to one of my competitors. So though in most doctors are altruistic and they want to do a good job for their patients, that little extra kick in the pants, going, Miss Smith can fire me if I don't do a good job for her, is a good way of assuring timeliness of replies, making sure that they have great access, that you give them adequate time and attention, because otherwise they can take those dollars and go elsewhere.
Well, and that's what competition is. So even in your business, that's what drives your own office and your own practice. Dr. Chad Savas with us. I've got a phone call that wants to weigh in. Let's go to Timothy from Hampton. Timothy, you're on the line live with Dr. Chad Savage.
My brother used to be on Obamacare for 2 years. His premium was $1,340 a month. That was $16,000 a year. He had a $5,000 per family member deductible, so his out-of-pocket maximum had to be reached first, and then it only covered 50%. So it backs up what you guys were already talking about. It was, and he had to move to another company. And when he moved to another company, he basically got a $1,000 a month pay raise because his new premium was $340 a month.
So basically, when under Obamacare, when you're telling this story, the annual premium, $1,300 a month, that's $13,000 plus $2,600, so $16,000 annually plus a $5,000 deductible, right? So $21,000 a year. Basically, your out-of-pocket is $21,000 before you get a dime, and then you only get 50%.
Yeah, and he's actually doing better than many, which is amazing. That's actually a better price than many people are getting quoted on the exchange. $26,000, even $30,000 for the premium alone, and then with the deductible and copays beyond that, and that's before they've even seen a doctor. We actually hear a lot of really legitimately terrible stories of people who wake up one morning and unexpectedly learn that they have a cancer and are stuck on top of it with a $60,000 bill. But where the other tragedy is the person who wakes up one morning and is surprised to find out that they don't have a cancer and yet is stuck with a $30,000 bill every single year in premium costs, even though they never saw a doctor. And those are stories, when you actually do the math, that actually lead to colossal financial damage to those people. And if we design the system better to allow for true prices in the system, both on medical services and on the insurance, I have another op-ed out, ironically, in Town Hall, which I know does your hard news segment, where I discuss that if you take the savings my own family has had in the last 5 years by switching to a health sharing ministry and you expanded it to 10 years, we could literally buy a house with cash with the savings that we achieved in that time. And that's while getting care. That's not in the deprivation of care.
Mm-hmm. Mm-hmm. Dr. Chad Savage, excellent take on that. Thank you, Timothy from Hampton. Dr. Chad Savage with us just had a great op-ed in Vice President Biden, Don't Take Away Our Health Care Choice. We'll get that up as commentary on the Virginia Star today. I'm going to send that up and get it in so you can go to the Virginia Star and see that, Dr. Savage. See, we're taking care of you, Dr. Savage. Once you get in the Virginia Star, I mean, you've made it into big-time journalism.
I feel honored.
I got your back, Doc. I got your back.
There you go. Right. Thanks, my friend.
Healthcare. I'm going to send it in now. Healthcare for you. That when you're the publisher, see, I can make everything happen. Just snap my fingers. Great position to be in when you own the medium, Dr. Savage. Where
free market. It's wonderful. You're the boss.
I know. Right? Well, actually, my wife runs the company. I'm the figurehead. But as long as I think I'm making the decisions, it's all good. Go. Yeah,
that's true. That's true for all of us. Though we all think we're the boss, but we really know who it is if you're married.
Well, when you're married 31 years like me, I mean, there's no resistance is. Let me just put it this way: resistance is futile.
And just like the Borg. Sorry, I'm digressing.
Non-compliance, Dr. Savage, is met with severe consequences. That's all. That's all I have to say. Just comply. It's like wearing a mask. Just comply. So, Dr. Savage, let's get to healthcareforyou.com.
I was going to say, it sounds like your wife is designing the liberal healthcare plan. It's non-compliance, severe penalties.
Oh, yes, sir. Non-compliance doesn't work in our family. Healthcareforyou.com. What is the tenets of this, and why hasn't the president taken this up?
Well, yeah. So basically, it's more free market and choice, and trying to again, my comment about agency and transparency. It's very much focused on that, and the president may have not taken every aspect of it up, but he has certainly made every attempt. I mean, he's a little bit limited because you need legislation to pass a lot of this, and Nancy Pelosi doesn't seem too eager to negotiate on some of these matters. So he's been trying to do what he can through the regulatory agencies, and the individual mandate is one of those examples. VA choice, getting more generic drugs approved and the like, are some of the things he's really done. And in fact, a lot of these changes will go into effect next year. So regardless who wins this next election, we're going to have improvements next year because of the actions the president has taken this year. And examples of that are in the state of Michigan, where I'm from. We're expecting a 54% reduction in Medicare Advantage premiums starting next year. He signed the executive order to allow for the reimportation of medications from Canada and the most favored nation clause, which means no longer will America be the country that gets the short end of the stick on drug pricing, that we're going to have to get some level of parity with other developed nations on our drug pricing, because right now we're really victimized by the rest of the world who they basically, they have these big systems. They say, we're going to pay 20 cents for a pill of Lipitor. And the Pfizer will say, but if you take our manufacturing costs and the R&D cost, it's 25 cents, even though it only costs 15 cents to make the pill. And they said, no, we're not going to shoulder any of that R&D cost. So that they go, okay, well, look at Canada. Canada says the same thing. They look around the world. No one wants to pay for the development costs. So they look at one nation of 330 million out of 7 billion people in the world, and they say, okay, America, you get to essentially bear the burden of all the R&D costs, but the entire world gets to benefit from it, which is great that they benefit from it. But when you talk about fair play, we should all be having some contribution to that cost. And by forcing a parity, if you will, with their pricing, the God's honest truth is other nations may come up a little bit in their pricing because they're going to have to bear part of that burden they didn't before. But American healthcare drug prices should come down dramatically because of his actions.
What you just laid out is really the case for that, and I appreciate it, Dr. Savage. Go to healthcareforyou.com, healthcareforyou.com. Dr. Chad Savage, let's have you back. And again, the one paragraph in your op-ed really summed up why Obamacare has failed. People say the premiums were too high and I got forced into it and it's government health care. But the real reason is they forced out small market competition. They forced out all those insurance companies. Prices went up. You had a mandate. And in the original bill, they colluded with the big insurance companies because if things didn't go right for them, they were going to bail them out. That was right in the bill. And that was one of the things that just nobody really talked about.
If I can add quickly, too, they talk about how this is terrible to the insurance companies, but I challenge anybody to pull up the United Health stock price between 2010 and 2020, in which case it's gone up over 1,000%. It's a heck of an investment in that last decade during Obamacare. In the preceding 10 years, it did increase really well. I mean, healthcare's been a meteoric industry to be in investment-wise. It went up, but it went up five-fold higher rate under Obamacare. So despite the bad mouthing that the industry gives to this, they have historic levels of profit, and which I'm not opposed to, as long as it's not unethically earned through government fiat. But they've had extraordinary record-setting profit levels, and their stock price has gone up in tenfold in 10 years.
Dr. Chad Savage, thanks for being with us today. I really appreciate it and appreciate your time. Dr. Chad Savage, Job Creators Network, participant in that. Thanks for being with us. I'm going to put your op-ed up right now on the Virginia Star. Go to the virginiastar.com.